Odontogenic tumors, they are basically, if you tumors are growth, right? So tumors are basically of two types. It is a benign tumor or it is a malignant tumor. Basic layman I am telling you, right? A benign tumor is a growth which has limited growth potential. Okay, which will grow slowly, which will not metastasize, that will not go to other sites, right? And is a malignant tumor. A malignant tumor is one that can grow abruptly, right? Uncoordinated growth will be there and it will also metastasize. Okay, so today we are starting with odontogenic tumors. Now what do you understand by the term odontogenic? Always try to divide the term. So odontogenic tumor, if I divide this word odontogenic, right? So odonto, the word only, okay, and genic means to form. So tumors that are arising from tooth forming tissues, right? In our jaws there are tissues, right, that form the normally, right? Such tissue, if it is leading to tumors, these are called as odontogenic tumors, right? So tumors that are arising from odontogenic tissues, forming tissues, number one. Now in your exam, it is a very important question, and what all can be asked in your exam from this? Number one, you can be asked, classify odontogenic tumors. Always there, whenever there is a long question on odontogenic tumors, they will ask you that first classify odontogenic tumors and then one kind of tumor, any one tumor they'll ask you usually. So there is a question on odontogenic tumors, there is a question on ameloblastoma, there can be a question on unicystic ameloblastoma, not very common these days, they have started asking on unicystic ameloblastoma, पहले नहीं पूछते थे, ठीक है. So unicystic ameloblastoma, calcifying epithelial odontogenic tumor, CEOT, okay, that can also be asked. Then AOT, adenomatoid odontogenic tumor, and odontome. There can be other questions, but these are the most common questions. Classify odontogenic tumors, ameloblastoma, AOT, CEOT, right, odontome, these are questions for odontogenic tumors chapter, right. Now let's understand the classification of odontogenic tumors. Many students keep on messaging me, ma'am, how to learn classification, It's very difficult to learn the classification, right? I'll just request one of you, if you are in the group, Nitin is in the group, just message that I have started live session in case anybody has forgotten and to join, okay? So odontogenic tumors classification, fine. Now remember, I told you this is the classification that is given in the book. It seems very difficult how to learn this classification. So first we will divide it into two headings. What are the two headings that we will divide it into? So the two headings are benign and malignant. So when we are classifying odontogenic tumors, we will divide it into two types, benign and malignant. Okay, this classification, it's a new classification, it was given by WHO, it is modified classification. Old is having the last Purana classification, this is the new one, 2017 modified odontogenic tumors classification. Okay, so two types, two headings we will divide first, benign and malignant, right? I told you what are benign, what are malignant. Benign are the tumors that are slow growing, malignant are, they can metastasize, they will grow, uncoordinated growth will be there. Okay, now further, right, I told you that these are coming from tooth forming tissues. So you should know basic dental anatomy. How is a tooth formed? A tooth is formed from odontogenic epithelium and connective tissue, two things. Okay, if you remember first year DADH, right, what was happening in first year DADH, we read about it. Lamina will be there, right, from that an enamel organ will form, correct? Enamel organ, initially it is bud stage, that is bud shaped, then this enamel organ will become cap shaped, then a bell shaped stage will come, right? All these, this is the epithelium, right? And below this there is all the connective tissues there. Two types of tissues they are forming, the tooth, epithelium and tissue, both of them will form, right? So how will we divide the classification also? The classification will also be divided into two types, right? First is benign and malignant, we have seen it, okay. Let's see now benign. In benign also will be three headings. Tumors arising from epithelium, I told you, right? Tooth forming epithelium, इससे कुछ बन रहा है अगर तो. So tumors arising from epithelium, okay. Number one, tumors arising from odontogenic epithelium. Number two, tumors arising from odontogenic mesenchyme. Mesenchyme मतलब connective tissue. is also called as mesenchyme, right? So tumors arising from odontogenic connective tissue, that is mesenchyme. Okay, and third is tumors arising from both epithelium and mesenchyme, right? So benign, malignant. Benign के अंदर again 3 headings. What are the 3 headings? Tumors arising connective tissue, that is mesenchyme. Tumors arising from both epithelium and mesenchyme. Okay, now let's first go to the in detail for the benign one. Fine. So when we benign tumors, let's first, I have made a mnemonic for you guys. Let's first understand how will we divide, how will we learn tumors arising from benign, that is benign tumors arising from odontogenic epithelium, correct? So for this, remember this mnemonic. What mnemonic is this? This mnemonic is Amma, remember this image, remember this lady, okay? Amma shall cut apple, right? I thought for the Amma will be the apt name, you can keep any name, Amarpreet, whatever you want to keep. Just remember this mnemonic, Amma, this is a lady, remember the image, images make things very easy to remember. Amma shall cut apples. If you remember this, then from Amma, the first name of the benign tumor will come. What is? Ameloblastoma, number 1, right? Shall, from the S, we will go to squamous odontogenic tumor. This is the second name that you have to remember. Okay, then cut, the C, CEOT, calcifying epithelial odontogenic tumor. Okay, and last is apple, from apple, emetoid odontogenic tumor. Okay, so 4 names you will remember, right? Amma shall cut apples, A for ameloblastoma, for squamous odontogenic tumor, right? Then cut, C for CEOT, and apple mein A is for adenomatoid odontogenic tumor. This is how you remember the first heading of the benign tumor. Okay, then the skin, how will we remember the tumors? The first was coming from odontogenic epithelium, the second is coming from odontogenic mesenchyme, connective tissue. So for this, remember this, COOC, okay, COOC, remember this thing. So from C, cementoblastoma, odontogenic fibroma, this you will have to remember, this much you will have to remember, just remember mnemonic and how we will put it. Odontogenic fibroma, odontofibromyxoma, and last is cemento-ossifying fibroma, right? They are coming from the mesenchyme, connective tissue, right? So this is the second thing that you have to remember. What is the third? So I told you benign mein epithelium, we saw Amma shall cut apple, then benign epithelium mein benign connective tissue, COOC, remember this, and for tumors coming from both epithelium and connective tissue, in this case remember DOPA, 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 okay? So DOPA, right? For this, dentinogenic ghost cell tumor is for D, correct? O say odontome, remember there are 2 types of odontome, complex and compound, you will learn it later. Then P say hai primordial odontogenic tumor, and last is ameloblastic fibroma. So 4. So for all categories for benign, we learned 4 tumors, right? This will become very easy for you to remember from this, right? So, okay. So if this is my classification for benign tumors, first is odontogenic epithelium, then mesenchyme, and then epithelium and mesenchyme. What was it? Amma shall cut apples wala, right? Ameloblastoma, SOT, CEOT, AOT. Then it is from mesenchyme, right? These 4. Then from epithelium, this will be COOC. And the last is epithelium and connective tissue, we will remember DOPA for this, DOPA, DOPA. Okay, so this is the benign part, right? Now let's see what about the malignant part, okay? Or for malignant also same thing we will follow. We will follow tumors coming from epithelium, tumors coming from connective tissue, they are malignant, and tumors coming from both epithelium and connective tissue. Okay. One thing remember, whenever a tumor is coming from malignancy, which is arising from any type of epithelium, that is always called carcinoma. Always. Carcinoma means a malignant tumor of epithelial origin. And second is, a malignancy arising from connective tissue is always called a sarcoma. Okay. So, carcinoma and sarcoma, remember these two things, and any benign tumor will always have the OMA, O-M-A. Okay. So, when we are reading about the malignant tumors, fine, no. So, for this, that are coming from epithelium, right, odontogenic epithelium malignancies will be called carcinoma, correct. So, first name we will remember is ameloblastoma carcinoma, second is प्राइमरी इंट्राओशियस कार्सिनोमा, थोड़ा तो याद ना पड़ेगा, राइट. देन स्क्लेरोसिंग ओडोंटोजेनिक अगेन कार्सिनोमा, राइट. सो व्हेनेवर कार्सिनोमा इट इज ओडोंटोजेनिक एपिथेलियल मैलिग्नेंसी. सो नेक्स्ट गोस्ट सेल ओडोंटोजेनिक कार्सिनोमा and clear cell odontogenic carcinoma. Okay, so here we will remember 5 names: Ameloblastoma carcinoma, primary intraosseous, sclerosing, clear cell, ghost, आगे का same है odontogenic carcinoma. This is malignancy from epithelial, correct. Next is, I told you, from connective tissue. Connective tissue always sarcoma. So which sarcoma? Ameloblastic fibrosarcoma. Only name you have to remember for this, ameloblastic fibrosarcoma. Next is coming from both epithelial and connective tissue, and only name we will remember because it is coming from both epithelium and connective tissue, it will carcinosarcoma. So odontogenic carcinosarcoma, right. So with this we will remember the classification of odontogenic tumors. Is it clear? You can just write in the chat box yes if it is clear to some extent. Okay, Sadaf, thank you so much. Anyone else? Is it clear? Thanks, Sadaf. Okay, fine. So, to brief, I am telling you it is one of the most commonly asked questions. We will keep okay. So, there are 2 headings: benign, malignant. Benign में odontogenic epithelium coming from odontogenic connective tissue, come from both epithelium and connective tissue, and same headings for malignant also, epithelium, connective tissue, both, right. In epithelium 1, right, thank you so much. Yeah, in epithelium 1 we will have 4 ama shell cut apple, ameloblastoma, SOT, AOT, CEOT, right. Then again in the connective tissue one we have COOC, mnemonic, then remember names. And for the both connective tissue and epithelium we have DOPA, DOPA, remember the names with DOPA, okay. Then for malignant I told you carcinoma या फिर sarcoma will be the name from, for epithelium के लिए 5 नाम है, cell odontogenic carcinoma, clear cell odontogenic carcinoma वाले 5 names are there, and for connective tissue only sarcoma वाला and carcinosis for both of them. This we are done with the classification of odontogenic tumors, right. Now let's go and see the ameloblastoma, one of the most commonly asked and for odontogenic tumor in your viva, in your paper, ameloblastoma. Okay, so ameloblastoma, right. Now if you know the classification, you know 2 about ameloblastoma already. What 2 points do you know? Number 1, you know that it is a benign tumor. Why? It is coming in the heading of the benign tumor, correct. And also it was coming in that ama shell cut apple, right, in the odontogenic epithelium. So 2 points to you know for the answer, benign tumor, and the tissue of origin is odontogenic epithelium. Okay, so 2 points we know. Now let's see further. I told you it is an odontogenic tumor, right, and tumor arising from tooth forming tissues. Okay, remember the name for, if anybody who is preparing for PG exam, what is the other name for ameloblastoma? The other name for ameloblastoma is adamantinoma. Okay, adamantinoma, remember other name for ameloblastoma. Fine. Then extremely important definition of ameloblastoma. Most of the times this definition is asked. Viva mein they will ask you this definition. Define ameloblastoma, and they'll ask you who gave this definition. For me during BDS, every time they ask me this definition and who gave this definition, and every time I used to forget one or the other points in this definition. Okay, so I've tried to make it easy for you. Right? First thing, remember that it was given by Robinson. Okay, so it was given by Robinson, correct? Second thing, how will we remember it? Tumor that is, so there are 5 points that you have to remember in this definition. How will we remember? Uniac, U-N-I-A-C, uniac, okay? So a tumor that is unicentric, okay, non-functional, N is for non-functional, intermittent in growth, okay, anatomically benign, and clinically persistent. Remember these 5 points. And how will you remember? UNIAC, uniac. Okay, so tumor that is unicentric, non-functional, intermittent in growth, anatomically benign, and clinically persistent. This is the definition of ameloblastoma. And what is the other name? We already did it. Anybody remembers it? Please write it in the chat box. What was the other name for ameloblastoma? Anybody can write in the chat box. Okay, so one thing I want to tell you, nobody remembers the other name for ameloblastoma? Adamantinoma. Sadaf, very nice. Okay, okay, at least you are listening to me. Okay, Nitin always listens. Okay, adamantinoma. Great, Nitin. Fine, cool. Then remember that there is no enamel or hard tissue formation in ameloblastoma. This is an important point. Great, 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 adamantinoma. Fine, people are writing it. Okay, now remember that in ameloblastoma there is no hard tissue formation. Tissue will not form, no enamel, dentine, cementum, nothing will form in this, right? So first, it is a true neoplasm of enamel organ type tissue, in which what is the function of the odontogenic cells? To form enamel, right? But they are not able to form it. This is an important point. Why? I'll tell you. So you'll remember this thing. पहला नाम क्या दिया इसको? Adamantinoma. Right? Who gave the term adamantinoma? It was given by Molasses in 1885. But this word adamantinoma का meaning क्या है? This word means to form hard tissue, and there is no hard tissue formation, no animation. Only odontogenic cells, they will mutate and all, and a tumor will be formed. Right? They not differentiate to the level that they form enamel. Correct? So there was word means to form hard tissue, but there was no hard tissue formation. So therefore, the name was changed by Churchill in 1904 to ameloblastoma, right? OMA, I told you, OMA is benign tumor, it's a benign tumor, and the cells that were seen in the slide, they were like ameloblast, so ameloblastoma was the name given. Okay, so now clear why the name was, other name was given for this. Fine. Now remember, when you are writing your answers in your exam, always write it under headings. Fine. So first you should always write the definition or basic introduction. For example, in ameloblastoma we'll write it's an odontogenic tumor, right? And it is during epithelium. इतना तो लिखेंगे, correct? Then you can write that Robinson definition, definitely, right? So whenever you're writing in your exam, follow these points. Basic introduction, it should be pathogenesis or etiology. If you know etiology of a tumor, write the second heading as etiology or pathogenesis. Now what is the etiology or pathogenesis of ameloblastoma? So there are 5, at least 4 you should remember. The fifth one is not that important, but at least 4 you should remember for ameloblastoma. Number 1, remnants of the enamel organ. I told you. So this is asked in exam, at least for 5 marks short note they ask you. Write pathogenesis of ameloblastoma, or what are the tissue of origin for ameloblastoma. So you should know this. Number 1, remnants of enamel organ. I told you it is forming from tooth forming tissues, right? So I told you there is a lamina, from it a tooth bud is there, it is enamel organ is there, right? And once the crown is formed, so this is dental lamina. Okay, this is the organ that will form the tooth like structure, then it will extend below and it will form structure. Anybody knows which structure I am talking about? Which structure forms the root of the tooth? Anybody? Which structure forms the root of the tooth? Anyone if remembers? Which structure forms the root of the tooth? I am waiting. You can even Google Hertwig's ciliary root sheath. Amazing. So there is a dental lamina, there is a enamel organ, correct? And this enamel organ, once it forms a tooth-like structure, yes, HERS, very good Sadaf, right? So there is Hertwig's epithelial root sheath, nothing, it will form the root of the tooth. Epithelial root sheath, it will form the root of the tooth. Okay. Now the remnants of the lamina, for example, the tooth is formed and there are remnants of the dental lamina. What they called as? They are called as rest of series. Rest of SERRES, rest of series. Okay. And the remnants of this Hertwig's epithelial root sheath that forms the root is called epithelial rest of molasses. Epithelial rest of molasses. Okay. So what they are saying, the first tissue of origin can be any from the enamel organ. Enamel organ ही बना रहा था ना ameloblastoma, odontogenic epithelium. So either dental lamina, that is rest of series. Again this can be an MCQ question. Rest of the remnants of the dental lamina, or Hertwig's epithelial root sheath, that will form that root. The remnants of this Hertwig's epithelial root sheath, either they will form it, right? So number one pathogenesis tissue is this. This we know. Okay, we are clear on number one. Now let's see what it is. Okay, so this is an image. This is the oral epithelium, dental lamina, enamel organ. This will extend to form the Hertwig's epithelial root sheath. So what they are saying, remnants of this or this enamel organ will form the ameloblastoma. Okay, what is the second tissue of origin? Second tissue of origin can be formed from epithelium of odontogenic cyst. Now I will not go to an odontogenic cyst now, I will keep a separate lecture for that. Just remember the cyst. What is a cyst? Always remember 2 points. A cyst is a cavity usually filled with fluid, not always but usually filled with fluid, but one of the most important things about a cyst is it is lined by epithelium. Okay, so what there is, an ameloblastoma can develop in a odontogenic cyst, a cyst of odontogenic origin. And which cyst? Usually dentigerous cyst. What is dentigerous cyst? A dentigerous cyst is a cyst which always forms around a tooth, usually third molar area. This is a dentigerous cyst. This is a dentigerous cyst. Okay, so what are they saying? The epithelium, in this some change will take place and an ameloblastoma can be formed. So the issue of origin is it can arise from an odontogenic cyst. Which cyst? Again this is a question, MCQ question. Which cyst? Dentigerous cyst commonly, or from an odontome. Again another tumor or hamartoma you can say, we will come to this later on. Okay. So this is the second tissue of origin. What is the third tissue of origin? Very easy now. Disturbance of enamel organ. I am telling you odontogenic epithelium. So either remnants of this dental lamina, Hertwig's epithelial sheet, anything, either rest or disturbance. Some disturbance has taken place, maybe tooth banai nahi. In place of tooth, an ameloblastoma is formed. Some mutation in this. So this is the third tissue of origin, right? What is the fourth tissue of origin? Fourth is basal cells of oral epithelium. Okay, so there is this is the oral epithelium. Iske basal cell, some mutation has taken place, some change has taken place, and it will lead to ameloblastoma. Okay. Now one more thing is heterotopic epithelium in pituitary gland. It is not very important. Okay. So 4 we will remember. Number 1, anybody can write in the chat box what is the number 1 tissue of origin that I told. What was the first thing that I told for origin of ameloblastoma? Anyone, if can write in the chat box. Okay, Hertwig's epithelial root sheath, yeah. Okay, remnants of the enamel organ, either remnants of the Hertwig's epithelial root sheath, that is epithelial rest of molasses. What is the second one? Another one, dental first rest of series or molasses. Very good, you have learnt it. Now what is the second one? What is the second one that you think? Anybody? Yes, yes Nitin, it is dentigerous cyst. Okay, so odontogenic cyst. Third one, the third one that we saw, or what I told you about, third tissue of origin. E1, third tissue of origin. The third tissue of origin was some kind of disturbance in the enamel organ. Okay, so some kind of disturbance in the enamel, that is the third. And what is the fourth? Fourth is basal cells of the epithelium. That's it. So 4 tissues of origin we have seen. So now what all we know about ameloblastoma? we know basic introduction, we know the what we read about Robinson's definition, right? And we also know about the pathogenesis, tissues of origin for ameloblastoma. What will the next thing, always when you write oral path answer, what should be your next thing? The next thing should be clinical features. Okay, so let's go to, okay, one thing that I did not cover. Now we have seen the tissues of origin, but why is it happening? Some kind of mutation, some kind of problem in the cells that form the tooth, right? Some kind of problem, mutation, right? Anything. So result, alteration or mutation in the genetic material of the cells that are destined to form a tooth-like. Okay. Now next is clinical features, right? What are clinical features? Clinical features are in which age you will commonly see a particular disease, and or in which sex, you know, female, male, where you will see, what is the age of the patient, how will be the clinical presentation of the patient. Okay, so ameloblastoma, what is the most common age for ameloblastoma? 33 to 39 years. Average age, average, it can be between 10 to 90 years. Okay, so 10 to 90 years is the range. You have to write in your answer this thing. Okay, so 10 to 90 years is the age, correct, but the average age is 30 to 39 years. Number one. Okay. Number two, how is the sex predilection? Is it common in males? Is it common in females? Almost same, almost same. 1:1 is the criteria for male is to female ratio for ameloblastoma. Right? So age is 10 to 90 years, average 33 to 39 years. Correct? Number one, age care. Then male, female, almost equal predilection. Fine. Let's go next point. What is the next point? Okay, very important. What is the site for ameloblastoma? So remember, usually ameloblastoma, just write all these points in your copy. Usually ameloblastoma, it occurs in the mandible. Okay, so it usually occurs in the mandible, and in mandible, so which area it is most commonly seen? So in mandible also most commonly seen in the ramus angle area, third molar area, right? So ramus angle area. So what you will remember in this? You will remember mandible, and in mandible also this third molar area or angle ramus area is the most common area for occurrence of an ameloblastoma. Remember the thing, only 1 point for site of occurrence. Okay. Then one more thing you should remember, it is the second most common odontogenic tumor, which is the first one. If anybody knows, they can leave in the chat, which is the first most common odontogenic tumor. Okay, this is the second most, in India this is the most common odontogenic tumor, but in general there is one more, odonto. Very good Sadaf, it's an odontome. Although odontome is controversial, it's a hamartoma, so there is a controversy, but yeah, ameloblastoma is the second most common, but in India it is most common. Okay, so then it is, we have already seen, second most common odontogenic tumor, benign, we know it's a tumor, it is slow growing. Okay, bony hard swelling. How will the patient to you? Will come with a swelling, mostly in this area, mandible area, not always in this area, but yeah, this is the common site. So bony hard swelling will be the problem of the patient, facial asymmetry, right? He'll come with ki yahan pe swelling ho gaya, right? So the bony hard swelling causing facial asymmetry. Fine. Then and locally invasive. Okay. So if we see this patient, fine, we can see this is just a patient ameloblastoma. It is not like if this is the such swelling is that it's always blastoma, but it was finally diagnosed as ameloblastoma. So there is a facial asymmetry because of the growth at the angle of the mandible, and intraoral also we can see this growth, right? This is the clinical features. Okay, then based on the clinical and radiographic features, okay, so there are types of ameloblastoma, right? So what are the types of ameloblastoma according to WHO classification? Solid or multicystic, this is the most common type of ameloblastoma. Remember, most of the questions are for this only, solid or multicystic. This is a classic blastoma, solid or multicystic, or it can be unicystic. This later on, unicystic ameloblastoma. Just remember, what are types of ameloblastoma? solid or multicystic, which is the most common classic type of ameloblastoma. Then sometimes cystic ameloblastoma. Then one more type is there, extraosseous or remember always, peripheral means out of bone. If anybody is telling you peripheral, term peripheral means bone ke bahar of the bone, right? Usually ameloblastoma is central, that is it is within the bone, intraosseous. But the second type is another type, one variant of ameloblastoma, peripheral or extraosseous, outside the bone, maybe in the gingiva, right? Then one more type, metastasizing ameloblastoma. This is current, the one right in your exam. There are types of ameloblastoma that is given, right? So remember these types, basic clinical and radiographic features, multicystic or solid, most common class type, unicystic, right? Peripheral or extraosseous, and metastablastoma. Remember this thing, okay? Then, okay, radiographically, most important thing, one word remember, you will remember ameloblastoma, classic type of ameloblastoma. It will have compartmental appearance, in the sense you will see many cyst like space within it, right? So what is classic type of ameloblastoma? Classically multilocular, right? It is multilocular. I'll just show you. Okay, for example, this is a growth, right? Fine. If this growth is having many septa of bone through it, this is a multilocular appearance. Okay, so this is a multilocular, many loculi will be there, right? What is the classic appearance? Multilocular cyst-like lesion of the jaw, that is compartmental appearance with septa of bone extending within the mass. So remember this one term, compartmental appearance or multilocular appearance, type of ameloblastoma. This also, right? So if the loculi are very small, then it is called as honeycomb appearance, right? Madhumakki ke jaisa, right? Honeycombed appearance. Or if it is very big, it is called as soap bubble appearance. Okay, can you see this, Sadaf? Small bony, I don't know if it is visible on the image on the screen, because screen has its own reflection, but multilocular appearance. Okay, then sometimes it can be unilocular, but this is not the classic type, but you will form, ऐसा नहीं है कि एक ही चीज दिखेगा, you can see other things also, okay? But usually, Sadaf, what your question is, that the septa of bone septa, they will extend between the tumor mass, which will give it a multilocular. That is the classic appearance, which is called as soap bubble appearance, right? And sometimes it is unilocular, okay? And periphery is smooth, and in advanced lesions you will see jaw expansion, thinning of the cortical plates, all these things you will see, okay? Is this clear till now? If you want, we can just brief it. So today we read about odontogenic tumors, right? We read about their classification, we read about benign, malignant, divided them into three headings, correct? And then we went to ameloblastoma. For ameloblastoma, we read about the basics of blastoma, we read about the definition of ameloblastoma that was given by Robinson, then we read about the 4 tissues of pathogenesis, right, for ameloblastoma, then we read about the clinical features, then we read about the radiographic features, right? Is it clear till now, all of you? You can just write in the chat box if till here clear to all of you. Okay, okay Nitin, thank you. Okay, fine. Oh, fine. ठीक है. Since you are till now here, it means that you understood the Shahana. Thank you so much, Sadaf. Thank you so much. Okay, fine. Right? This is the way we will write in the exam with headings and everything, correct? To score good marks. In the next class, I will take the histopathology of ameloblastoma, okay? And I will also take, if possible, unitic ameloblastoma. Every Monday at 7, I will be taking a live class for you guys. Since you guys are here, I think you understood it. Give it a thumbs up, share it with your friends so that it's clear for them as well. If you have not subscribed to the channel, subscribe to it as well. And I will